Hi, Steve Small, IDD Therapy Disc Clinics. I am often asked whether IDD therapy is just traction and therefore it doesn't have a place in treatment because traction doesn't work. What I want to just say is that IDD therapy and the Accu SPINA evolved out of the question, what are the failings of traditional traction? The key thing with traditional traction was that it was not able to target specific spinal segments, to distract and then mobilize in a longitudinal plane at specific points along the spinal column. Manual therapy can resolve 90%, if not more, of back pain issues that haven't resolved by themselves, but there is a category of patient who needs something more than manual therapy. This ability to target specific spinal segments enables us to create a program, a series of treatments where treatment forces are built up to over half a patient's body weight comfortably and safely. And this enables us to decompress specific discs and through distraction and mobilization, which you're familiar with, to improve the mobility in the joint. Patients spend 25 minutes on this machine. But that's not the whole picture. There are other modalities that go along with it. And the key thing with the IDD is that patients, there are so many variables, patients have a multitude of needs. Treatments are tailored to the individual, and so we can use manual therapy and of course exercise. The IDD therapy enables us to create a platform to get people, alleviate the stiffness and immobility in the spinal segment, and from there develop this strengthening through a range of motion to give people better quality of life. It's not going to cure everybody. There will be some people who need surgery and in certain conditions it's not going to be effective. But for patients, particularly those with disc problems, herniated, bulging, slip discs, with or without leg pain, it really does provide an excellent solution. Some patients can respond very quickly. A few treatments they can get symptomatic relief because we're relieving pressure off a nerve. But generally we expect to see patients firstly getting improved movement and then pain relief comes later. This wasn't something that really happened with traction. Traction was typically given 4 or 5 treatments. If it's worked, great. If it hasn't, let's try something else. And there was very imprecise methodology in the way traditional traction machines were used, and that's before we consider that actually the technology was old and not able to to achieve that level of precision. So yes, there is some traction in the DNA of IDD therapy and the Accu SPINA because we're using pulling forces, but it's IDD takes traction to a whole other level, particularly with the targeting, with the mobilization, and with the forces and the way those forces are delivered so that it's comfortable for the patient. If you're still thinking, you're not sure, come and try the treatment. Just come and try on the machine and you will experience for yourself. You will feel better. 90% of people will feel better when they've tried the treatment, those people without back pain. And for people who have back pain, it's a progressive improvement in the main. So I'm Steve Small, IDD Therapy Disc Clinics. Go along to your nearest disc clinic, try the treatment and see for yourself. Thank you.